One of the most difficult moments a family can face is watching a loved one approach the end of life. As changes begin to occur, many people wonder, are they suffering? Is this normal? And what happens next? Understanding what the body naturally does during the final days and hours of life can help replace fear with knowledge and bring comfort during an emotionally challenging time. Welcome to the Funeral Channel Network, brought to you by the Funeral Program site. Our goal is to provide compassionate, educational information about funeral planning, end-of-life care, memorial traditions, and the realities families may encounter when caring for a loved one. In today's presentation, we'll explore the meaning of active dying, the physical and emotional changes that often occur during this final stage of life, and how understanding the process can help families focus on comfort, dignity, and meaningful connection during a loved one's final journey. Watching a loved one approach the end of life often brings an overwhelming flood of grief, anxiety, and uncertainty. This anxiety is usually rooted in the unknown. Without a clear understanding of the biological process of death, families often mistake the body's natural transition for a state of suffering. Hospice professionals use the term active dying to define the specific final phase of this journey. It marks the point where death is expected within days or hours, rather than weeks or months. This phase is a natural process where the body prepares itself for death. It is a predictable biological sequence, rather than a medical crisis or a struggle. Recognizing this timeline allows families to move away from fear and focus instead on creating an environment of comfort and connection. Most people experience a period of gradual decline before this final stage begins, marked by weeks of limited mobility and a significant decrease in daily energy. The transition into active dying is often marked by a sharp increase in sleep and a reduced responsiveness to the outside world. Breathing patterns also begin to shift. You may notice irregular, rapid breaths, followed by distinct pauses where the person does not breathe at all for several seconds. As circulation changes, hands and feet often feel cool to the touch. You may also notice mottling, a blotchy purple discoloration on the lower legs. The body is conserving energy, shutting down non-essential systems and directing blood flow toward the vital organs. While these physical signs can be difficult to witness, they are the specific biological markers of a body successfully navigating its final transition. One of the most common concerns for families is the fear that a loved one is starving as they lose interest in food and fluids. Biologically, the body is simply losing the ability to process nutrients. Attempting to force food or drink during active dying can actually lead to physical discomfort rather than relief. There is also a frequent assumption that irregular breathing or changes in consciousness are signs of pain. In most cases, these are painless physiological shifts. When comfort-focused care is provided, the transition is typically a peaceful one. Hospice teams facilitate this by monitoring clinical symptoms and providing the education families need to understand why these changes are occurring. Having professional support to interpret these signals removes the burden of medical guesswork, allowing the family to remain present as loved ones. Even when a person appears completely unresponsive, hearing often remains intact longer than any other sense. Caregivers are encouraged to continue speaking, sharing favorite memories, and expressing love and forgiveness during these final hours. To stay focused on these emotional moments, it helps to have the logistical realities of the situation managed well in advance. This involves discussing final wishes, preparing legal documents, and pre-planning memorial preferences before a crisis occurs. The Funeral Program site offers resources, guides, and checklists free on their website to help families navigate these decisions. These preparations acknowledge that active dying is a deeply personal, spiritual, and cultural experience that extends far beyond the medical events. When the logistics are settled and the biological process is understood, the environment of the room changes. families can move past the uncertainty of the unknown and focus on a final chapter defined by dignity and connection. As difficult as it can be to witness the final days of life, understanding the process of active dying can help families replace fear with compassion and uncertainty with peace. The physical changes that occur are often the body's natural way of preparing for death, not signs that something has gone wrong. By recognizing these changes and focusing on comfort, families can spend less time worrying and more time simply being present with the person they love. Thank you for joining us for this important discussion. We hope this information has provided reassurance, clarity, and a better understanding of what active dying means. If you found this presentation helpful, please consider subscribing for more educational content on funeral planning, end-of-life care, memorial traditions, and grief support. We'll see you in the next video.